Dr. Fauzan, the floor is yours.
Good morning, distinguished colleagues, participants, speakers, discussants, moderators, rapporteurs, old friends from the government of Indonesia, UN agencies, international funding institutions, think tanks, NGOs, the media from over 16, 17 countries, the speakers, and of course our SMERU colleagues, all the line ministry colleagues, everyone, welcome. It is my distinct honor, after a very inspiring opening by the highly esteemed ministers and also deputy minister and UNICEF representative, to welcome Dr. Katja. Dr. Katja is research coordinator at the United Nations Research Institute for Social Development, UNRISD, that some of you might know is based in Geneva. She has studied in Germany and Argentina and holds a PhD in economics from the Free University of Berlin. She has managed and is managing many research projects on the politics of domestic resource mobilization for social development, protecting and promoting children's rights and well-being in resource-rich countries in Asia, regional governance of migration and socio-political rights, economic development, social protection, of course, poverty reduction, etc., etc. She has many publications, including co-editing the Financing Social Policy, Mobilizing Resources for Social Development in 2009, and other publications that you are welcome to look up at the UNRISD website. It is really an honor for us to have Dr. Katja amongst us today in Jakarta as our first keynote speaker. And I think with that, I will please join me in welcoming Dr. Katja, and I'll hand it over to her.
Thank you very much, UNICEF, for the kind introduction, distinguished policymakers, distinguished organizers, and dear conference participants. Let me first of all thank UNICEF, SMERU, and the government of Indonesia for hosting this conference and for inviting UNRWA to open this meeting. It's a huge privilege to be here and to discuss with you the potential of social protection for combating child poverty and for increasing the capabilities and well-being of every child. Bringing together such a distinguished group of policymakers, practitioners, and academics for the coming 2 days already signals how social protection has evolved from a residual category to a key policy instrument within global and national poverty reduction strategies. We all know that debates and agenda setting is not enough to change lives on the ground, but it is a first and necessary step in order to raise awareness and to build consensus and coalition for change. Widespread poverty, vulnerability, and exclusion of children are among the greatest challenges the global community is facing, both from a developmental and a human perspective. When UNICEF rightly states that the principle of investing in children rarely evokes controversy, as to invest in a child is to invest in our common future, why is it then that child poverty persists, despite some progress over the last decades? Is it a lack of understanding that leads to adoption of ineffective strategies, a lack of funding or a lack of state capacity, a lack of political will and priorities, or a lack of commitment from the international community to take responsibility and share development gains and losses? When UNRWA started its work on a 2010 flagship report on combating poverty and inequality, one of our leading questions was, what accounts for the persistence of poverty when concerns for its reduction have been very high on the policy agenda? What we found in our research was that current approaches to poverty often ignore its root causes, focusing on measuring things that people lack to the detriment of understanding why they lack them. A consequence of this line of thinking is to deal with symptoms without being able to move to the heart of the problem. Instead of trying to find isolated solutions to the poverty problem or to focus excessively on designing programs for the poor, we suggest in the report to analyze poverty reduction as part of a long-term process of social, economic, and political change, and to connect the poverty issue with broader development dynamics. With this holistic approach in mind, in the following I will focus on the role that social policy plays for poverty reduction and child well-being as part of such a long-term process of social transformation. I will organize my talk around three themes. First, poverty and inequality, where do we stand? Second, social protection programs. What is the potential for poverty reduction and what are the challenges? And third, child poverty in Asia, time for social protection. I will argue that child development is a positive development outcome, but more importantly, it is a driver for equitable growth and better societies. However, eradicating child poverty and deprivation requires overcoming political, social, and economic barriers, as well as developing comprehensive policy frameworks that impact on the root causes of poverty and inequality. Lack of employment-intensive growth and decent work, lack of social contract that combines sustainable and equitable financing with institutionalized social rights, and lack of empowerment and political voice for non-elite groups in the poor. Poverty and inequality. Poverty reduction has been on the international policy agenda for decades, but the focus of strategies has changed in line with dominant development theories and ideologies. After 2 decades of strong reliance on market forces and poverty reduction via growth, more comprehensive approaches, such as those promoted at the Copenhagen Social Summit or through the MDGs, have regained policy space and have moved social development up the development agenda. Whereas the Copenhagen Declaration emphasized interlinkages between full and productive employment, social integration, and poverty reduction, the MDGs set out to address poverty in its multiple dimensions, from income poverty to nutrition, education, health, gender equality, and sustainable development. So 2 years ahead of 2015, where do we stand? As we can see on the slide, a lot of goals have been achieved or are in reach. Especially the global poverty rate fell from 47% in 1990 to 22% in 2010. And we have 700 million less people in absolute poverty. The hunger reduction target is also within reach. And 2 billion people gained access to improved sources of drinking water. Over 200 million slum dwellers benefited from improvements in their living conditions. Mortality rates from malaria fell by more than 25% globally. And an economic indicator, a very important one for fiscal space, debt service to export revenue ratio decreased from 12% in 2000 to only 3.1% in 2010. But on the other side of the coin, there are still 1.2 billion people living in extreme poverty, and another 2.4 billion people are vulnerable of falling into absolute poverty because they're just above the $2 per day threshold. 870 million people are still undernourished, and more than 100 million children under age 5 are undernourished and underweight. Child mortality under 5 dropped, but the envisaged 2/3 reduction might not be achieved. And although the number of children out of school declined by almost half between 2000 and 2011, it is also unlikely that the target of universal primary enrollment can be achieved. The same applies for maternal cohesion, social mobility, and balanced power structures, lower levels of crime and violent conflict, and less push factors for migration. So have we made progress towards greater equality over the last decades? The answer is yes and no. We see some progress concerning income inequality between richer and poorer countries, although we can also see on the graph that the gap is still huge. And at the same time, there is a lot of backlash with regard to inequality within countries. As we can see in the graph on the Gini coefficient. Next, please. Most of the countries, especially the Asian countries, that have departed from a very quite low level of inequality have actually increased the levels of inequality. And only very few countries like Brazil, which is a country that has started off a strong poverty reduction programs and other measures from a very high level of inequalities, actually achieved some improvements. But it's not only these kind of broader indicators of inequality that show us that this has been a negative development of some of the positive growth episodes we have seen in the past. If we zoom in further on patterns of inequality within countries, we see that absolute poverty is no longer concentrated in the poorest countries, but actually that most of the global poor live in middle-income countries in emerging markets. And your country is one of these. A second important point is that national averages often hide important disparities, a fact that several international agencies, and in particular UNICEF, have highlighted. Poverty and deprivation is multidimensional, cumulative, and overlapping. And the most disadvantaged children are suffering from multiple deprivations in areas such as income security, access to basic services, nutrition, housing, and participation. Not all adults or children that are income poor are suffering from multiple deprivations, and many persons that are above the poverty line are still deprived of basic services and capabilities. This slide gives you some examples on how to measure multidimensional poverty and how deprivation can be measured. We can look at income poverty or vulnerability, at health and nutrition, education, early childhood development, water and sanitation, living conditions such as housing and electricity, emotional well-being, information and participation, but also indicators such as birth certificates. These indicators depend very much on country context. Something that goes beyond country context is that poverty studies have shown that the most disadvantaged households or individuals are likely to or live in rural or remote areas or in urban slum areas, be disabled from an ethnic or religious minority, including migrants, be a girl or a woman, live in a poor household, live in a household with a high number of dependents, or live in a household where the head of household is female or unemployed. What is interesting about these risk factors is that they seem to be very stable over time, because you can actually find the same list of risk factors for being poor in World Bank reports from the 1970s and 1980s. I want to illustrate the impact of these horizontal and vertical inequalities by looking at one social outcome in the education. And I take the example of Bolivia, but I know that you have very similar examples from very many developing countries and even emerging markets. In Bolivia, the average year of schooling is 9.1 years. However, if we look at a typical indigenous woman living in the rural sector, belonging to the lowest income quintile, this average goes down to under 3 years. And if you look to the contrary, to a man who lives in urban areas and belongs to the highest income quintile, is non-indigenous, this average goes up to 13.6 years. So we have a difference in educational outcomes of more than 10 years. And education is truly considered a crucial opportunity in the determinant of human capabilities and life chances. Let me now come to my second area, social protection programs. What is the potential for poverty reduction and what are the challenges? First of all, some definitions, because social protection is defined very differently by different agencies and actors. At UNRWA, we say that social protection is concerned with preventing, managing, and overcoming situations that adversely affect people's well-being. And social protection programs aim to assist individuals and households in maintaining basic consumption and living standards when they are confronted with contingencies such as unemployment, illness, maternity, disability, or old age, as well as economic crisis or natural disasters. It's also important to note that from a development perspective, social protection is not only concerned with specific risks over the life cycle, but with reduction of poverty and vulnerability. Social protection is defined, as I said, differently by different organizations, but usually comprises social insurance, which are the contributory programs, social assistance, which are usually non-contributory or tax-financed transfers or in-kind transfers, and labor market policies, which ensure basic standards and rights at work, including collective bargaining, minimum wage policies, unemployment insurance, and prohibition of child labor. Social protection is a subset of social policy, which also includes social services and other policies with redistributive or social objectives. For example, policies for the rural sector, or microfinance even. There is great value in thinking of social protection within this broader framework, and to design comprehensive and integrated systems that cover social services, income protection, and basic rights and legal standards. While more recently emphasis has been put on the instrumental value of social policy, we should not forget that social security is a value of its own and a basic human right, grounded in human rights and international conventions, as we can see on the slide. The right to social security, the right to medical care and social services, right to education, the ILO conventions, especially 102 on minimum standards, the Convention on the Rights of the Child, and the Convention for the Elimination of All Forms of Discrimination against Women. This rights-based framework is very important, and it should guide related policies, laws, and implementation in every country. However, despite the recognition of these intrinsic values, social policy has often been considered, and is often still considered, a luxury for low-income countries and for developing countries in general. It was seen as something that would come very late in the development process, basically a development outcome and not a driver. And I think it's in this regard that the sea change has occurred more recently, over the last decade especially. And social policy is increasingly seen as having multiple positive effects on development performance. Unrest argues that the transformative potential of social policy is grounded in its multiple roles that extend beyond protection. And actually, social policy addresses concerns of production, of redistribution, reproduction and care, social cohesion, nation building, and democratization. Indeed, when we look at international policy debates, initiatives, development agendas, we can see that social protection is becoming more relevant, and that its remit is becoming broader over time. It has moved from the safety net approach of the Washington Consensus period to the more comprehensive approach of the Social Summit in Copenhagen, to the formulation of the PRSPs with a strong focus on pro-pool spending, to the MDGs, and last but not least, the Global Initiative on National Social Protection Floors, led by the ILO. Within this debate, it is clear that social assistance is gaining relevance because of its great potential for poverty reduction, but also because of slow progress with regard to social insurance coverage and labor market policies. And within social assistance programs, cash transfer programs have grown immensely over the last years. There are estimates that cash transfer programs already cover 750 to 1 billion people in the developing world. In 2010, these programs operated in 52 countries, including 16 low-income countries. And there are numerous studies and evidence that these programs have a positive impact on poverty, a less visible but still an effect on inequality, on nutrition and food security, educational performance, health outcomes, and even on climate change and disaster risk reduction. It would take me far too long to go into detail on these studies, but this is really a growing body of literature which has very robust analysis and shows these effects. On the next slide, you can see some of the largest programs in the world, which are well known for those that study social protection programs. We have the minimum living standard scheme in China. Okay. We have the minimum living standard scheme in China, Oportunidades in Mexico, Bolsa Familia, and the social pensions in Brazil, the child support grant and social pensions in South Africa, the different safety net schemes in Indonesia, the National Rural Employment Guarantee Scheme in India, and the Productive Safety Net Program in Ethiopia. I think now it's the slide that was before. It's also important to look at the different design of these programs and the types and categories of social assistance. We can distinguish between unconditional income transfers. They can be universal or they can be targeted. They can be categorical for specific groups like pensioners or children, or they can be universal for citizens. It can be income transfers conditional on work, income transfers conditional on human capital investment, like the conditional cash transfers for families, and in-kind transfers and subsidies also fall into this category. We observe that cash transfer programs are expanding in comparison to in-kind transfers and subsidies. But the actual mix of programs depends very much on country context. To give you some more examples from Asia. In Asia, for example, in the Philippines, we have a very big conditional cash transfer scheme, Pantawid Pamilya, which actually at the moment covers 8.5 million children, and there are very ambitious plans to extend this program. The minimum living standard guarantee in China covers around 75 million people, and most of them live in rural areas. We have social pensions in Asia, universal ones in Nepal and Thailand, and targeted ones in Bangladesh and Vietnam. The unemployment benefits are more concentrated in the higher income countries in the region, like Japan and Korea. But we have employment programs and public work schemes with very high coverage rates in India and Bangladesh, for example. And social health insurance is also usually a feature of the more developed countries. But we have important programs such as Jamkesmas in Indonesia, which covers 9.3% of all children. Let me now also give you some evidence on social protection in Indonesia. Although I know that we will have a lot of more detailed presentations later at this conference. UNICEF has developed a social protection country strategy, and in this context also done, in collaboration with SMERA, a comprehensive child poverty analysis. And as I heard from Angela this morning, the first ever done in the country. And these are really impressive publications that bring together an analysis of the economic, social, and political background of the country and the different social protection programs in a very integrated and holistic way. And the findings are very interesting. 58% of households in Indonesia are covered by some program of social protection. And the incidence is higher for poor and vulnerable groups. The transfers that families receive are used to meet children's needs, for example, expenditure on food, medical expenses, or school fees. The main programs are the health insurance for the poor, the program Rights for the Poor, and the scholarships. And there are important percentages of children covered through these programs, especially from the biggest one, the Rights for the Poor. The conditional cash transfer program covered 816,000 households in 2010. And if I understood the minister right this morning, it has gone up to 1.5 million in 2012. There are also unconditional cash transfers, which are basically compensation for fuel price increases. They're time-bound, but the coverage is impressive, 18.5 million households. The study also puts forward a number of very important recommendations, which are very much in line with what I said in the beginning, that it is important to link social protection initiatives and interventions with broader development interventions. The study recommends, for example, to tackle implementation problems and to strengthen monitoring and evaluation. To approach poverty in its multidimensional forms, beyond income poverty. To focus on long-term social protection strategies that include also interventions in health, nutrition, education of poor children, or economic assistance of households. To do more about information and awareness raising of families and households about the benefits of investing in children. And to inform recipient households about, or those that are entitled, about their rights. Let me now, in the last part of my presentation, summarize briefly the challenges to extending social protection. And I want to focus on three main points: coverage, adequacy, financing, and implementation issues. I think one of the biggest challenges for social protection is expansion of coverage. And it doesn't matter whether we think about social insurance or non-contributory social assistance, but there are so-called difficult to cover groups, which also figure prominently amongst those that are actually excluded from social protection benefits. And these are migrants, informal workers, the rural population, and if we look specifically at children, not all children, of course, are vulnerable, although we know that children have specific age-related vulnerabilities. But children that are specifically vulnerable are orphans, street children, child workers, child migrants, disabled children, and those children that are from excluded families or communities. The ILO statistics show that only 20% of the global working population and their families are actually covered by comprehensive social security. So there remains a lot to do. I think that the Global Social Protection Floor Initiative is a good strategy in order to proceed with coverage expansion at the national level, because it shows that it is not that it is essential to provide some very basic guarantees and access to healthcare, but it's not enough to stop there. It's actually a kind of a staircase towards comprehensive social protection, which also includes social insurance, contributory social insurance, and these rights and protection at work. In terms of adequacy, again, we have international benchmarks, and the ILO conventions actually tell us the social assistance benefits should be in the range of 30% of the median wage. A social security benefit, a pension should have such and such a replacement rate. But what we can actually see is that, especially if we look at social assistance, benefits are usually quite low and often not sufficient to lift people out of poverty. And I just give you two examples. On average, the social pensions in Asia only reach half of the poverty line. And the Indian Employment Guarantee Scheme only pays a wage that is a third of the minimum wage in the country. There are alternatives, but of course they have fiscal implications. For example, in Brazil, social assistance benefits are linked to the minimum wage standard. And if we talk about the success of Brazil in reducing inequality within the country, it was very much this minimum wage standard and all the social protection instruments linked to this minimum wage standard that has contributed to this success. I come to the second challenge, financing. First of all, fiscal space and affordability usually increase with income level. I can show you a slide where we can see, thank you, that social expenditure increases with income level, and we see that the highest social expenditures in percentage of GDP are found in Western Europe, followed by Central and Eastern Europe, North America, Latin America, Asia, and the lowest expenditures in Sub-Saharan Africa. Nevertheless, this is an average, and as always, it hides the important differences. The next slide shows actually that there are countries with the same per capita income and very different social expenditure patterns. We can see it when we compare high-income countries like Japan and Singapore, but also for middle-income countries like Indonesia and Mongolia, or low-income countries like Cambodia and Nepal. Of course, there are a lot of determinants for social protection expenditures and social security expenditures. But this very blunt comparison just shows you that these expenditure levels are also a policy variable. So they are not set in stone, and we don't have to wait for passing a specific development threshold in order to spend more or to design more comprehensive systems. When we think about how to finance social expenditure, there is a range of instruments, of course. And in our institute, we have done quite extensive research on how we can finance social policy in a sustainable and equitable way. We looked at taxation, at aid, at revenues from extractive industries, but also at the impact of household expenditure or out-of-pocket payments, or remittances, for example. I don't have the time to go into details about financing, but what I wanted to stress and put up for discussion also later during this conference is that if we design social protection strategies, we also have to design them together with the financing instruments and the financing techniques. So we can be sure that on both sides we produce equitable and fair and sustainable outcomes. Because taxation policy has also redistributive effects. And if we ask households to pay for social services out of pocket, this has distributive and welfare impacts. So my message on financing is that when we design financing instruments, we have to think about the impact on distribution, efficiency, and on governance. My last point on challenges for social protection, implementation and governance. Usually when we talk about state capacity or governance, we think about the capacity of bureaucracy, of implementation, some sort of management or technological knowledge. But in our institution, we define state capacity as something broader, and we actually include a political dimension. For us, state capacity has three dimensions. One is political capacity. That is the capacity to create the coalitions and the political settlements to define, adopt, and implement policies. The second state capacity is resource mobilization capacity. So actually the capacity to extract revenues, for example, from the extractive sector through taxation or other means. And third, resource allocation and enforcement capacity. Now our recommendations are, instead of focusing only on a good governance agenda, to focus on the three dimensions I just mentioned. This also means that redistribution of power is important, that involvement of citizens in allocation and monitoring of certain resources is important, that we should not neglect reform of bureaucracy and administration, and that, for example, for improving decentralization, involvement of the poor in local decision-making is important. I come to my conclusions. I think that Asia has been a pioneer in combining quite a robust growth performance with stability and even employment creation in a number of countries. In this sense, we have talked in the past about the Asian miracle. This might have been somehow modified a little bit after so many crises we went through since. But I still think that in terms of economic development and diversification, a lot of Asian countries are really leading in the world. I think that it is now really time to scale up social protection in order to make these growth patterns more inclusive and sustainable. It's important to integrate contributory and non-contributory income transfers, access to services, labor market policies, and to strive for universal and rights-based systems. Secondly, social policy systems need to build on financial arrangements that are themselves sustainable in fiscal and political terms, equitable and conducive to social development. Political arrangements, strategic alliances, and social dialogue are all important for building a national consensus or social pact. Universal programs can generate broad support from groups with ability to pay and political influence. And this is very important for the political and financial sustainability of social protection programs. We have to create these linkages between different groups in society. And enhancing equality and equity also requires special efforts to guarantee access to social services and transfers for the most disadvantaged. And this is part of a child-sensitive social protection strategy. As I said in the beginning, it is very good news that social protection is taken seriously. But it is a long and windy road from agenda setting and ideas to policies and development.
So I think with that, I would like to open to the floor to questions. And as I said, we have about 20 minutes, so maybe we can go for one round of 3 questions and then see how we're doing. I believe we will also have some questions perhaps from Twitter participants in our discussion, but we'll wait to hear from my colleagues on that. So thank you once again very much, Dr. Katja, and we're open to questions and comments from the audience now. Please, it would be very good if you could kindly introduce yourself, your name and organization before you mention your question. Pasif, there is behind you.
My name is Asif Surihadi from Day1c Keynote. Thank you, Katja, for very enlightening presentations. I have a question related to your last point about the post-MDG Global Development Agenda. What do you think? How should social protections be formulated into the new Global Development Agenda? Should it come as a single goal within this global development agenda, or should it be just a cross-cutting issue covering many goals? So I'm curious about your thinking on this issue. Thank you.
Thank you, Pasif. Any more comments or questions? Yes, please. Ruti.
From UNICEF in Japan. Actually, the last part is very interesting, related to the financing. From your studies or from the research that you've seen, what are the recommended, let's say, formula? Is there any, like, in terms of defining source for social protection financing? Because I understand that for implementation it requires some mobilization and poolings, but with regards with the numbers and also GDPs or other capital investment, how do you share from the studies?
is Alexander Hauschild from IDP Norway. And you have mentioned in your presentation that social protection is a multidimensional issue, education, health, and so on. You and your colleagues in the Research Institute are under the impression that there is enough correlation between the ministries related to these different issues, or is there enough coordination among the international aid community that programs implemented in countries are actually coordinated between different sectors? Programs related to poverty reduction, improvement of health service, education service, and so on. Thank you.
We have a question about the financing and also coordination.
Thank you very much for. Okay, if you can't hear me, please raise your hand. To the first question on the post-entity agenda and social protection, I think that just to have one goal on social protection would be probably too broad. I guess that if we stick to the kind of measurable and time-bound goals for the next development period, that it would need to be, again, something that focuses on specific social outcomes. I think probably the next development agenda will be slightly broader, and it will, as I said, include not only social development goals, but also some goals with regard to inequality, for example, or empowerment. So this will be interesting. I'm not sure whether the request of many low-income countries that actually economic goals should feature more prominently, or employment goals will also be there. But in general, I think the more specific in that sense, the better. Because it is, if not, it's very hard actually to keep track of how these goals then are actually achieved and what type of progress countries are making. What I think would be a mistake is just to focus the global development efforts on, again, a list, a short list of some development goals, and not to see it as part of a broader and more comprehensive development strategy. And I think when we look back to the Millennium Declaration, or we look back to the Social Summit in Copenhagen, there we can actually see the documents that really draw out the linkages, the broader frameworks that are important for achieving positive development results. So my recommendation would be to be specific about social protection objectives, but not to isolate any goal that will be decided upon from a broader social development strategy and framework. Second, on the question about financing, whether we have some recommendations coming out of our studies. I think that, first of all, what we see is that the financing mix actually is very context-specific and different in each country. Those countries that have very extensive social insurance schemes finance a large part of their social expenditure through contributions, actually, which in a way is a form of an earmarked tax, of course. So social insurance that is financed through contribution has an advantage. In a way, it is fiscally neutral in its ideal form, in a way. You collect contributions, and through these contributions, you finance the benefits. There are, of course, two pitfalls to this ideal model. One is that many of these systems have deficits, and therefore need subsidies from the general budget. And this can have negative distributional consequences if social insurance covers mostly the better off in society, and tax revenues also are collected from the poorer segments of society, for example, through value-added tax. then we have actually a subsidy flowing from the general population to a rather privileged group of those employees that are insured through social insurance. If we look at social assistance, it's more, we have often a broader coverage, but as I said, quite low benefits, and usually the portion of the budget that goes into social assistance expenditure is still quite low. So we have often expensive systems in terms of social insurance for a minority of the population, and quite low social expenditure to finance actually social protection programs that cover a large part of the population. How we can finance these programs in a sustainable way, however, is more complicated, because social assistance, as I said, is financed usually from a general pool, from taxation, or sometimes from aid money. So in a way, we have to look at the national tax systems. How comprehensive are they? How progressive are they? How efficient are they? And I think there is a lot of scope in many countries. And it is also time that those policy actors and practitioners that are working on social protection actually sit together with those expert specialists and policymakers that decide about revenue policies, because both of them really go together, and also the financing policies have redistributive and other impacts, not only revenue impacts. With regard to the third question, social protection, when we define social protection as income transfers basically, and when we include the whole range, let's say social services, health, education, housing, income transfers, we talk about social policy. But I know that all the different agencies there have a different definition. But it's true what you said, that social policy has a specific characteristic. It's very fragmented. It's a very cross-cutting issue, and there are so many actors, institutions, ministries, and agencies involved. And that does not only happen at the national level, but as you said, also within the donor community or international organizations. So there is a huge demand with regard to coordination, actually, and dialogue. And I think there are some good models, but it depends very much on the country context. I could, for example, recommend the ILO model as well, which is social dialogue where employers, trade unions and workers' organizations and the state sits together. Of course, there are others saying, but civil society, this is a corporatist model. Where is civil society? Where are the NGOs? So it might not be the right model for each country. In other contexts, it would be important to include somehow civil society, NGOs, and other actors. But there is a huge need for better coordination in order to avoid fragmentation, overlaps, duplications, and all these inefficiencies that arise when each ministry or each agency only pursues sectoral interests in a way. And as I said, from our point of view, in order really to have a coherent and efficient social protection strategy, we need to really bring all the different strands together. So there is a huge need for cooperation. But in terms of best practices, I think there is not an easy list on best practices for these kind of governance or political issues. Maybe we should work on that and bring together the evidence we have from country studies on that. But it's context specific, and I think there is a lot of need for kind of political will and dialogue at the national level, and also within the donor community, of course.
I'm glad that you made many references to dialogue. approach and also our other approach related with dealing with the social protection issues and addressing the child opportunities. We did some exercise in trying to identify mapping out the social protections program, its gaps, and trying to narrowing the gaps. And some of the recommendations, among others, came out is we need to have the integrated approach through the single window service, which is some of trying to combine between the social services with the employment services. It is kind of that I think similar what you actually suggested. But the thing is, in the case of Indonesia is now is one of the emerging countries shifting from low to the middle income countries, which is large number of the middle class. But the thing is, one of the assessment that we had is there's a missing in the middle, which is so many numbers of the informal workers, which is if we're trying to financing the social protections, and then having also we have the very low taxation rate. Any other example in other countries how to deal with this kind of issue, although that there is a political commitment from the government by having the universal coverage, for instance. But the thing is, although based on our assessment that's only need 2.5% GDP, still low that compared with another budget allocation through the subsidy. But I'm interested to know whether there's another example in other countries in dealing with the informal workers to provide them the social protections. Having we have the low rate of taxation rates, which is of course experienced with budget deficits, budget deficit.
Actually, as I said, there are some difficult to cover groups that are the same in each and every country of the world, basically. And informality often, and not always, but is often a reason for not being part of a social insurance scheme or not being able to contribute to a public or private insurance scheme. This is also, I think, why social assistance has risen so much on the national and international policy agendas, because it's basically the only instrument. It's a range of instruments, but it's a lot more efficient and effective in reaching those populations that are part of the informal economy. Nevertheless, there is one big problem with regard to let's say, covering the informal economy only with social assistance benefits, and that is the level of benefits. It continues to be something that only guarantees a certain subsistence level, but it does not really allow people to be part of a development dynamic or a growth dynamic. And if we think about the children of these families also, it's probably not enough really to offer them what we would like to do, which is a kind of a future where they are part of a positive development and where there is some sort of social mobility and improvement of the social situation and economic situation of the future generation. If the informal workers and the poor families cannot move beyond this kind of minimum level, it's very difficult to offer to children these kind of dynamic future. So in that sense, it should be an objective of social policy really to think beyond a minimum level and to see how to actually upgrade somehow these employment situations so that people can actually also have a decent wage which allows them to participate in contributory schemes to reach a higher income level. But I know that this is very difficult and that different countries have different schemes and instruments in order to achieve it. I think there is really no magic bullet at all in that sense, and no country has really achieved a big breakthrough in this regard. And I think this is also the result of developments which actually push towards a greater informalization in many countries today. So even if government is maybe successful in formalizing some, or in kind of lifting some people out of poverty or bringing them into more formalized employment situations, at the same time informality is growing elsewhere. So we have this dynamic which has really started over the last 20 years. In many countries that had more formalized labor markets actually now display higher levels of informality despite a lot of efforts. So I think the outlook is not very optimistic, but there are some instruments and programs, simplified contributory schemes, simplified tax schemes, more control and legislation and enforcement of minimum wage policies that can be also applied to the informal economy. And some countries have been successful in that regard. But there's always a kind of a balance between designing, as I said, it's the same with poverty reduction. There's always a trade-off between designing special programs for special groups, because that also can perpetuate the situation in a way. So also with the informal economy, we have the experience that the more there are special programs and special tax rates and special contributory schemes for low-income groups or the informal economy, sometimes the more difficult it gets to graduate out of these simplified schemes, which has also revenue implications, of course, for the state. Because if the lower income groups don't pay taxes or don't pay income taxes, and the higher income groups evade because of the power situation, then there is very little left. And as the colleague from ILO said, if there is a huge gap in the middle, it is difficult actually to design tax and social insurance schemes that are sustainable. And this is also why we have to think beyond the poor, and also to think about those quintiles that are above the poverty threshold. They're nearly poor, but also the lower middle classes, because they are really the kind of future social classes that can support social systems and also participate in holding governments to account, in monitoring the quality of services, in participating in financing them, etc. So I always advocate for these kind of cross-class linkages because they really make social systems stronger.
So I'm sure there'll be plenty of time to interact with Dr. Katja during lunch and afterwards. So thank you again, Dr. Katja, and thank you all. And I'll hand over to our MC.